Now let's study the paranasal air sinuses. They are air containing bony spaces around the nasal cavity lined by respiratory epithelium. So that's why they are called as paranasal air sinuses. Para beside the nasal cavity. So that's why they are paranasal sinuses, and they are air sinuses because they contain air. So try to differentiate these sinuses from the sinuses which are present within the cranial cavity. Those are called as dural venous sinuses because they contain venous blood and they are within the dura mater. So those are different from the paranasal air sinus which are present in the bones of the face. Okay. These are nothing but the air containing bony spaces around the nasal cavity, and they are lined by respiratory epithelium, that is the sedated columnar epithelium. So we can say they are an extension offshoot of the nasal cavity itself. They are extending from the nasal cavity. What is their function? We'll come to that later. They are rudimentary at birth, except the frontal sinus. Then they start developing during the secondary dentition, that is 7th or 8th year, and they are well developed after puberty. Okay, so only after puberty they are well developed, and usually they are absent at birth except the frontal air sinus. Okay, so these are the air sinus, okay, which have been shown. This is the nasal cavity. Around this nasal cavity there are air sinuses. So they are arranged in pairs and they are of 4 types. The first one is called as the frontal air sinus, which is present in the frontal bone. These are the frontal air sinus. So they are in pairs. Then we have the ethmoidal air sinus. In the ethmoid there are 3 air sinuses within each, the anterior, middle as well as the posterior, which are again in pairs on either side. Then we have the maxillary air sinus within the maxilla, the bone of maxilla, that is the upper jaw, and we have the sphenoidal air sinus within the sphenoid bone, and ethmoidal air sinus within the ethmoid bones. That's why depending on which bone they are present, they are named accordingly. Okay, so they are frontal air sinus, then the ethmoidal air sinuses, sphenoidal air sinus, as well as the largest one, which is the maxillary air sinus. Okay, here you can appreciate again these sinuses. The frontal air sinus has been shown in the frontal. This is the frontal bone. Within the frontal bone, there are the frontal air sinuses. The maxillary air sinus within the maxilla. This is the maxilla bone on either side. Within the maxilla, there are maxillary air sinuses. Then we have the ethmoidal air sinus within the ethmoid bone, and the sphenoidal air sinus behind within the sphenoid bone. Okay, so that has not been shown here, sphenoidal air sinus, but it will be behind. When you take a section, at that time we will see. Okay, coming to the functions. What is the function of these paranasal air sinus? Why they are present? Okay, the first and the foremost is air conditioning chamber. They act as the air conditioning chambers. Whenever we breathe in the air, okay, so they are conditioned, okay, and the humidity is added, as well as the temperature will be maintained. If the external temperature is higher than the body temperature, then it will try to reduce, and if the external temperature is lower than the body temperature, then it will increase the temperature. So that's why they regulate the temperature as well as add humidity to the inspired air, so that it doesn't go inside the lungs and the respiratory air passage and damage. Okay. The second is resonating chambers. They act as the resonating chamber, production of sound. So whenever we sound, the sound is produced, it will be resonated. So because these are cavities, air filled spaces, they just resonate just like an empty room, big room, and if you scream there, the sound will be resonating. Similarly, whenever we speak, at that time the sound along with the air, the sound which will be coming, it will be resonated, and it will be produced as a good quality sound. Okay, so the sound is resonated by these chambers. Then the facial bones are lighter because of these spaces within these bones, the large spaces. So this will lighten the bones of the face. They help in the lightening of the facial bones. Okay, Then the fourth and the fourth one is the mucous secretion. Along within these chambers, because they are lined by epithelium, ciliated columnar epithelium, and they have lot of, along with the ciliated epithelium, there are a lot of mucus secreting cells within them. Okay. And this will be secreting mucus. This is important, especially during if there is any infection of these air sinuses, especially the maxillary sinus, which lead to lot of complications if there is excessive production of the mucus. Okay, so these are some of the functions of the paranasal air sinus. First is they acts as the air conditioning chambers. Okay, by adding the humidity as well as regulating the temperature. The second is they help in resonating of the sound which you produce. The third is it lightens the facial bones, and the fourth is they secrete mucus secretions. Okay, coming to the first and the foremost, that is the maxillary air sinus, the largest one, which is the maxillary air sinus, which is present within the maxilla. This is the large maxilla. Okay, which is the upper jaw. Within this upper jaw there is a big cavity around the nasal cavity. See this, all these sinuses around the nasal cavity, and the largest one, the maxillary sinus, is beside the nasal cavity on either side. Okay, so they are the largest of the paranasal air sinus present within the body of the maxilla and roughly pyramidal in shape. If you see, they are almost triangular in shape or pyramidal in shape. Okay. So if you take a section here, so this is how it looks beside the orbit. This is within the maxilla. We can see the maxillary air sinuses. Okay, on either side. This is the nasal cavity. This is the nasal septum. This is the nasal cavity. These are the concha. So this is the inferior concha, middle superior concha. Okay, and here is the middle concha within to which the maxillary air sinus will open. Okay, so they are the largest of the paranasal air sinus, the maxillary sinus, present within the body of the maxilla and roughly pyramidal in shape. The size almost 3.5 centimeters into 2.5 centimeters into 3.25 centimeters length, breadth, as well as the width. As you know that the maxillary air sinus is triangular in shape or pyramidal in shape, as you saw it. It has an apex as well as a base. The apex is directed towards the zygomatic process of the maxilla. Here is the zygomatic process, so it is directed toward this is the apex of this maxillary sinus. This is the apex. Then the base is toward the nasal surface of the body of the maxilla. So the base will be here toward the nasal cavity, nasal surface of the body of the maxilla. Here is the apex and here is the base. So here you can appreciate this is the apex and the base is toward the nasal cavity. Okay, then the roof is toward the orbital surface of the maxilla. This will be forming the orbital surface of the maxilla, that will be forming the roof. This is the roof, and the floor will be here. So here will be the floor. The floor will be the alveolar process of the maxilla. Here is the floor itself. So that will be by the alveolar process of the maxilla. So this has an apex, a base, roof, as well as the floor. So this is the apex, this is the base, this is the roof, and this is the floor. Okay, the anterior wall is related to the infraorbital vessels as well as the muscles of the upper lip anteriorly, and the posterior wall bound by the boundaries of the infratemporal as well as the pterygopalatine fossas. Then the opening of this maxillary air sinus is into the middle meatus, into the middle. This is the middle meatus, which is just below the middle concha. This is the middle concha. So just below the middle concha, below the ethmoidal bulla. So here will be opening of the middle meatus, drains into the middle meatus through the floor of the hiatus semilunaris. Hiatus semilunaris, let me show you later, is just below the bulla. So there is a circular structure that is called as the hiatus semilunaris just below the bulla ethmoidalis. Okay, so it will be opening here into the middle meatus. So this is the opening of the maxillary sinus. Okay, so this is all about the maxillary air sinus. Coming to the blood supply of this maxillary sinus by the anterior, middle as well as posterior superior alveolar vessels. Here they have shown you the anterior superior alveolar vessels. Here is the posterior superior alveolar vessels. All these as well as the middle superior alveolar vessels, all will be will be supplied by the maxillary vessel. So this is a maxillary artery which will be supplying this the anterior, middle as well as posterior superior alveolar arteries will be supplying. Then the venous drainage will be by the similar names, anterior, middle as well as posterior superior alveolar veins, which will be draining into the maxillary vein. Okay, coming to the lymphatic drainage, it will be into the submandibular group of lymph nodes here, and the nerve supply will be from the anterior, middle as well as posterior superior alveolar nerves, branches of the maxillary as well as the infraorbital nerves. This is the nerve supply. So as you have seen, this is the maxillary sinus. This is the X-ray showing you all the air sinuses. These are the maxillary sinus, and here you can see this is the frontal air sinus. Here are the ethmoidal air sinus, and the sphenoid air sinus cannot be seen with this view. Okay, coming to the frontal air sinus, this is the frontal air sinus on either side within the frontal bone. They are paired and present within the two tables of the squamous part of the frontal bone, deep to the medial end of the superciliary arches. So here will be the superciliary arches. Deep to that on superciliary arch, deep to that will be the frontal air sinus. So here you can see this is the frontal bone. Within the two tablets of the frontal bone, you can see this is the frontal air sinus. Okay, so they are paired and present within the two tablets of the squamous part of the frontal bone, deep to the medial end of the superciliary arches, as I showed you. They are triangular in shape. Again, they are also triangular in shape, as you saw here. So they are also triangular in shape, similar to that of the maxillary sinus, but they are smaller. They are triangular in shape and asymmetric. Okay, they are not symmetrical but asymmetry. Vertical, the size vertically it is 3 cm, transverse is 2.5 centimeters, and the anterior posterior diameter is 1.8 centimeters. And this will be opening into the middle meatus through the ethmoidal infundibulum and hiatus semilunaris. Okay, so along with the maxillary sinus, this frontal air sinus also opens through the middle meatus. Blood supply is by the supraorbital vessels, the artery as well as the vein. Lymphatic drainage will be into the submandibular group of lymph nodes, and the nerve supply will be by the superior orbital nerves. So here will be the superior orbital artery, vein as well as the nerves. Everything will be supplied by the same supraorbital vessels as well as nerves. Okay. Now coming to the second one, ethmoidal air sinus. So ethmoidal air sinus within the ethmoid bone. So present between the medial wall of the bony orbit and the lateral wall of the nose. So it is present between the orbit and the lateral wall of the nose. So the medial wall of the orbit and the lateral wall of the nose is formed by the ethmoid bone. So this is the cribriform plate of the ethmoid bone. This is the horizontal, this is the cribriform plate, and this is the crista galli of the ethmoid bone. This is the cribriform plate of the ethmoid bone, and this is the perpendicular plate of the ethmoid bone. And these are the spaces where the ethmoidal air sinus will be present on either side. Okay. So present between the medial wall of the bony orbit and lateral wall of the nose. Between the orbit and the lateral wall of the nose will be present. These are the ethmoidal air sinus. They are present within the labyrinth of the ethmoid bone and variable in number. Okay, between 3 to 18, and thus they are grouped into anterior group, middle and posterior group. Within each group there are multiple, they are not just 3, but they are more than 3. Okay, so they are grouped into anterior. Those which are present anterior, they will be called as anterior. They are which are present in the middle, they will be called as middle, and which are present in the posterior, those are called as posterior. So they are not one single, but they are in multiples. The anterior group will be usually in the number of 3 to 7 small air sinuses, open into the middle meatus through the ethmoidal infundibulum and hiatus semilunaris. This anterior group also opens, as even the middle group also opens into they are usually present in 1 to 3 numbers of these sinuses, and form the bulla ethmoidalis, as you can see here in this picture. So the bulla is formed by the middle ethmoidal air sinuses. Okay, so this elevation within the lateral wall of the nose, the bulla, is formed by the middle ethmoidal air sinus and drain into the middle meatus on or above the bulla. They open on or above the bulla. Okay, so the middle as well as the anterior groove open into the middle meatus, but the posterior, usually which is present from numbered from 1 to 11 sometimes, okay, opens into the superior meatus. Okay. Coming to the blood supply, the anterior and posterior ethmoidal branches of the ophthalmic artery will be supplying, and the lymphatic drainage will be into the submandibular as well as even to the retropharyngeal group of lymph nodes. Especially the posterior one will be draining into the retropharyngeal group of lymph nodes. Okay. Now coming to the last one, that is the sphenoidal air sinus. Sphenoidal, this is the frontal air sinus. This is the sphenoid bone. Within the sphenoidal bone, this is the sphenoidal air sinus, which is opening above the superior concha. Okay. So the sphenoidal air sinus, they are paired and present within the body of the sphenoid bone, above and behind the nasal cavity. So this is the lateral view of the sphenoidal air sinus. This is the anterior view of the sphenoidal air sinus. If you take a section, so this is the sphenoidal air sinus which are present on either side. Okay. And they are very important relation. We will talk about that. Openings, this sphenoidal air sinus, as I said, will be open into the sphenoethmoidal recess in the superior meatus. Above the superior meatus, there is a recess within which this sphenoidal air sinus will open. Blood supply is from the posterior ethmoidal vessels, and the lymphatic drainage will be into the retropharyngeal group of lymph nodes because they are behind, and the nerve supply from the posterior ethmoidal nerves and the orbital branch of the pterygopalatine ganglion. Okay, so this is about the sphenoidal air sinus. The most important will be the relations of the sphenoidal air sinus. As you can see, it is present behind the nasal cavity within the sphenoid bone. This is the sphenoid bone, and within the sphenoid bone, this is the ethmoidal air sinus, the sphenoidal air sinus, and opening into the superior recess above the superior concha. So it is behind the nasal cavity, and there are very important relations beside this sphenoidal air sinus. So superiorly, if you see here, it is the pituitary gland which is present on the top of it. Okay, and above that will be the optic chiasma, and below that will be the pituitary gland. Okay, then beside this sphenoidal air sinus, there are the dural venous sinus here. Okay, the cavernous sinus on either side. This is the dural venous sinus on either side, very important sinus, cavernous sinus, which will be mainly draining most of the part of the brain itself, as well as the cranial cavity. So this venous drainage to from all the parts, most of the parts of the brain as well as the cranial cavity will be into the cavernous sinus. So this cavernous sinus on either side will be present beside, on the lateral side of the sphenoidal air sinus. This is the cavernous sinus. Along with that, there are also very important structure within the sphenoidal air sinus. One is the internal carotid artery, then the third cranial artery, the cranial nerve, the third cranial nerve, that is the oculomotor nerve, then the fourth, the trochlear nerve, then we have the fifth nerve, cranial nerve, that is the trigeminal nerve, the ophthalmic as well as the maxillary division of the trigeminal nerve. The mandibular will not be there, but the ophthalmic and maxillary divisions of the trigeminal nerve will be present here. Okay, even the abducent nerve, this is the abducent nerve, which will be the sixth cranial nerve. All these nerves are beside it, as well as the cavernous sinus. Above we have the pituitary gland, and above that will be the optic chiasma, and above that will be the diaphragmatic sella. Okay, all this will be there. So very important relations of the sphenoidal air sinus will be very important structures around the sphenoidal air sinus will be there, and they have a very important relation. Okay, so this is all about the sphenoidal air sinus. Coming to the last part, that is the applied aspects. Infections, especially coming to the air sinus, as we said, if there is deviated nasal septum or sometimes directly the sinuses get infected. The most commonest will be into the infection of the maxillary sinus, or sometimes secondly the frontal air sinus which get infected. The most commonest will be the maxillary sinus, infection, and if it becomes chronic and it is very difficult to treat with antibiotics and other thing, then they go for surgery. And there are two kinds of surgeries where they do the antron puncture itself, or there is also called the Cadwell's luck operation, through which they try to drain the excessive production of the mucus within the maxillary sinus. Coming to the fourth part, that is the carcinoma of the maxillary sinus is common compared to the other air sinuses, and usually it arises from the mucus lining of the air sinus. If there is chronic infection, continuous irritation, that can lead to carcinoma of the maxillary sinus itself. So this is all about the paranasal air sinuses which are beside the nose. So if you have any doubts, you can write to me and I will try to answer. Thank you very much. Hi friends, if you like my video and if you want to see similar kind of videos in the future, subscribe to my channel as well as like the video. Press the bell icon so that you can get regular updates and you will be the first to get the updates. Then you can also comment as well as share this video with all your friends so that all can benefit from this. Thank you very much.